Okay, now we go to the different infections, diseases associated with your Staph aureus. So we have the skin and the wound infection. So the first one, we have your folliculitis. Folliculitis is just the inflammation of the hair follicles or the oil glands. We characterize here by the inflamed area ng mga hair follicles natin is usually red and raised. So may angat siya na parang inflamed area, swollen area. Foreign cause, on the other hand, this is large, raised, and superficial abscess, and usually it's just an extension of your folliculitis. Carbuncles, on the other hand, ay mga group ng forancles, dumami sila ng mga bilog-bilog na pustules, but this one would have here a deeper tissue invasion. Next, we have here your bolus impetigo. It's just a pustules here. So, para siyang mga lesions, mga pustules, mga bilog-bilog. Okay, usually are large and surrounded here by zone of erythema. Mean to say, parang may pustules siya, tapos parang red. Para siyang, what you call this one? Red ang kaniyang surrounding area. That's your bolus impetigo. On the next one, we have here your scalded skin syndrome. So this is just usually scalded skin syndrome is being manifested among infants, and this is characterized by excessive exfoliation or dermatitis. So para siyang nagpipeel off ang skin. And your scalded skin syndrome is actually caused here by our exfoliative toxin produced by your Staph aureus. Again, another name of your exfoliative toxin is your epidermolytic toxin. Toxic shock syndrome here is caused by your enterotoxin F. Okay, so this is characterized here by sudden onset of the fever, chills, headaches, malaise, and it could may lead here to your hypotension and shock, and it's fatal, nakakamatay. So that's why toxic shock, that result here to your toxic shock and death of the patient. Again, it's caused here by your enterotoxin F or your toxic shock syndrome toxin 1. Next, we have your TE and your toxic epidermolytic necrolysis. Okay, so this is caused here by a variety of causes. So it would resemble actually manifestation with your scalded skin syndrome, partial peel of the skin. Only that your toxic epidermolytic necrolysis, okay, is basically being caused here by, again, it's just partial severe hypersensitivity reaction or allergic reaction related to your skin infection. And this one is maybe caused here by drug-induced, so drug administration, current allergic reaction out of your drug intake. It's maybe also caused here by some infection or even induced by vaccine administration. Again, your toxic epidermolytic necrolysis resemble your scalded skin syndrome toxin, but scalded skin syndrome, but you need to carefully differentiate if it's that is toxic epidermolytic necrolysis ba talaga or scalded skin syndrome. Basically because the two here differ with the treatment. Okay, so toxic epidermolytic necrolysis is eventually treated by your steroid administration. But your scalded skin is not treated by your steroid. It will aggravate actually the condition of your scalded skin if the patient will be given here steroid. Kaya dapat alam mo or you should differentiate and specifically if that one by scalded skin kasi dapat hindi ka bibigay ng steroid. But if that one is your toxic epidermolytic necrolysis, then you give a steroid as its treatment of choice. Okay, so we have here your